I often reflect on how the way I counsel has changed now after counseling for so many years. I look back and, of course, the way that I counsel has changed. It's taken many different iterations. I think that now the way I counsel is quite drastically different than the way I counseled many years ago. I used to counsel in the traditional fashion, which is the 50-minute counseling hour. And I would work with individuals and couples for 50 minutes a week. They would come in 1 week, leave, go back to their routines, and then come back the following week for 50 minutes. And I didn't pay close enough attention to the fact that they often left frustrated, without having received what they needed, the skills, the opportunity to really share what was on their heart and to really explore the patterns that were taking place in their life. And in that sense, I was really insensitive to what was going on with them. I wanted to fit them into my schedule rather than me adapt and change and meet their specific needs. So at the Marriage Recovery Center, I'm influencing all of our clinicians to be more sensitive to how we are counseling. And the way we're counseling now is far more intensive. We offer a 3-hour marriage evaluation, for example, 3 hours, where they can really unpack what's going on in their marriage and then get a clear treatment plan. Then it's very, very common for me to recommend that I continue to work with this couple on 2-hour sessions per week, maybe even 2-hour sessions per week, maybe even a 2 or 3 day marriage intensive. People really, really are responding to these changes. And why wouldn't they? Why wouldn't they? Who wants to come in and unpack a suitcase, dump it out for 50 minutes, and then stuff it back into the suitcase, going home only to have the stuff fall out of the suitcase again, and then stuff it back in, bring it back into the counseling hour, talk about the latest issue, try to fix the latest issue, and then go back home? So I'm Dr. David Hawkins, and I'm the director of the Marriage Recovery Center, and we are doing things very, very differently. This requires more of us, and it requires more of you. So we have to be prepared. We have to adapt and accommodate our schedules to meet an increasing demand for our time so that issues can really be addressed and looked at in an in-depth way. Now, couples come for the marriage evaluation. Couples receive more intensive programs. We have different programs for different issues. And we have the marriage intensive. We have personal intensives where both men and women come for 2 days and really take a look at what's going on in their life. And then we have the 3-day marriage intensive, where couples can really look at the patterns that are going on, their self-defeating traits that get in the way of them having healthy and wholesome relationships, and then identifying these problems, and given new skills, they're able to eliminate these self-defeating patterns and develop new, healthy, connecting patterns. So if the old way of counseling isn't working for you, and I suspect it's not, it just doesn't work. I'm surprised that more clinicians aren't giving it up. But if that's not working for you and you're looking for a more intensive, more compassionate, caring environment and an opportunity to really be held and cared for, where your problems are really looked at, pointed out, identified, and given opportunities to really change them, and then with very adequate follow-up care, if that's appealing to you, please reach out to us. We want to help you. We're the Marriage Recovery Center. We've got many different clinicians. We work with trauma. We work with emotional abuse. We work with many different issues, and we work with them on an in-depth basis if that's something that you're looking for. All right. We hope to hear from you. Take care.